We're here today with one of my good friends, Dr. Molly James, who is a COVID warrior. Uh, she helped people, she was an ICU doctor during the pandemic, and she helped rescue people out of the hospital. I don't know anybody else that did what you did. And you actually managed to escape the wrath of the board. I know they went after you, but you were exonerated. And then
Yes.
now you're trying to get a license in Texas. But I think they don't like the fact that you testified on my behalf because they're giving you all sorts of trouble. What's going on with the Texas license?
Yeah, so I applied for a Texas medical license a year ago, November. So I have intention to move to Texas. I have personal reasons for relocating, and never ever has it taken more than 8 weeks, maybe 12 weeks to get a medical license. I have a very clean record. I've done a lot of jobs, so that's the hardest part of usually getting licenses. Every one of the jobs has to send a file on you. I have a lot of state licenses, so that's the main thing that ever slows down the process. Never in my wildest dreams would I have thought it would take 15 months and I still don't have a license. So the Texas Medical Board maybe should stop looking at your tweets and start checking their mailroom because my references, Dr. Verone tweeted this, so I feel comfortable saying it. He sent a letter for me 3 times. I believe you had to send a letter 3 times because of their criteria and they couldn't find it. So it'd be really nice if we could get that pushed through. I have a clean record and there's no reason for that to get held up.
Yeah, it's very suspicious. And I discovered yesterday that 25% of physicians in Texas are trained in other countries.
Oh,
And
interesting.
yeah, and then they just passed a law in Texas streamlining the licensing process for foreign trained doctors because there's a shortage of doctors, but somehow
Mhm.
they can't process your application. It's very odd.
Yeah.
Um,
Yep. We've tried to cooperate with them. We've followed up. You know, the routes between the time we have a question and the time we hear back is a 2 to 3 week delay. Generally, they say your application's closed at 12 months, and basically, I said, well, this is your delay. So as far as I know, my application isn't closed. However, it's just inexplicable delays. So at this point, I am suffering, financial damages based on their ineptitude. So hopefully, we can get that sorted out pretty soon.
well, tell us, I know that you have some exciting new treatment for the vaccine injured, and that's why I brought you on today because
Mhm.
it's been very difficult to help these patients.
Mhm.
It's a lot of trial and error, and it's especially with the neurological issues, very difficult to treat. And we're, left to figure out things on our own because the government is not helping us. So
Yeah.
tell us what you have been doing and have had success with.
Yeah, so one of the things I brought into my practice at the end of 2025 was it's a MitoRegen therapy, so mitochondrial regeneration. Basically, the layman's way of thinking about that is there's a signal, there's a microscopic oscillation of insulin that is sent to the liver from the pancreas. Studies date back in the 1970s. They put catheters in and figured this out. There's a tiny signal of insulin going to the liver that the liver then releases enzymes that support the mitochondria. So throughout illness, we lose this signal. So the mitochondria stop using glucose as a source of fuel and basically lose their efficiency. So a very brilliant engineer figured out how to replicate this oscillation through an external pump. So we can now replicate that signal IV. It's a 3 hour infusion in my office. It's just a tiny amount of regular insulin. And over the last 30 years, they've repeatedly studied and published on this, and it increases ATP production by 30%.
Wow.
So, yeah, we eat food, and our mitochondria turn food into ATP, which is kind of our Duracell battery. It's our unit of energy. And so, increasing ATP production by 30% has wonderful implications for people.
Well, and is it last? Is it you do this infusion and then how long do people feel immediately better? And
Yeah, it's kind of across the board. So it depends on what we're treating them for, what their condition is, and what they're trying to get out of it. So they've repeatedly published that neuropathies, after 12 treatments, 90 to 95% resolved.
really?
Mm-hmm. And
Wow.
I've had, yeah, so if anyone out there is suffering from neuropathy, you don't have to. The medications just mask it. It is an energy production problem. I've had a patient, she's actually on my team, has chemo-induced neuropathy. And within an hour of starting the treatment in our chair, the burning sensation went away.
Wow. Wow.
So this is truly profound. Um, it has implications, to me, the mitochondria is the root of the root problem. And so I explain it like this. If you're tired, if you're exhausted, you're not going to be cleaning your house. You're not going to be doing home maintenance and repairing your roof. Our cells do the same thing. So if they're exhausted and not making enough energy, they're in survival mode day to day and they're not running their higher order operations. So if we can get them that extra energy, now they're just like we do. They're going to wake up, they're going to start cleaning out the cell, they're going to start doing their processing, their detox. And we have an inherent program in our DNA to repair. Our cells know what to do if they have the right energy. So basically, we give them the power to do their own healing.
Wow. And so it's an IV that lasts for 3 hours, and
Mhm.
you're giving tiny amounts of insulin during the IV. Do you give them
Yeah,
glucose too, or how do you
yeah.
prevent their?
Yeah, that's actually one of the hardest parts of the treatment. So we're literally talking about 5 cc's over 3 hours. That equates to anywhere from 10 to 15 units of insulin, maybe total. So very small amount given every 6 minutes as a pulsation. The hardest part for people is my patients are usually eating low carb or carnivore, keto. They're avoiding processed sugars. So when we're doing this, they actually have to carb load.
Mm-hmm.
And so we check their blood sugars every 15 minutes because as we wake up the mitochondria and now they're using glucose for fuel, it drops people's blood sugar. So we want to make sure as we wake those mitochondria up, we can feed them and they have energy to use so they can keep making energy.
Interesting. And then how, if they do multiple treatments, how far apart are the treatments?
It depends on, again, what we're treating them for. So, the people I trained with had a patient that literally had a terrible wound on the foot and was trying to avoid amputation. That patient was treated every day for 4 months, I believe.
Mm.
So 80 treatments back to back. In our office, that's not usually feasible. So if somebody's really sick, we're looking at 2 or 3 times the first week, and then we may titrate that off to once a week, and then eventually once or twice a month for maintenance if they have a chronic process we're trying to keep reversed.
Right. And then have you had luck with the vaccine injured patients?
Um, I don't know that we have as many of those patients. You know as well as I do. They've been victimized so many times that by the time we get to something that actually can work for them, they're out of money and they're out of hope and they're out of trust in the medical world. So, again, to come out now 5 years later and say, I have the solution for this, there aren't a lot of people who have faith in that. So, definitely, I'd love to bring this to the vaccine injured because we know that the spike protein was a direct mitochondrial toxin and it should work pretty well for this.
Right.
Yeah.
And you have multiple offices now. Where can people find you?
Yes, so our main office is in St. Louis in the Chesterfield Valley. We have a small office in my hometown in Sheraton, Iowa, and we are opening in the Des Moines market in Q1. So later this year, in just a couple months, we will be open in the Des Moines market.
And then I think you were talking about Texas as well, right? If they'll ever give you a license.
If they'll give me a license, I have a couple other things that now need to fall into place, but we're really excited to open in Texas as well. We have sites on Tyler, Texas, and or the Hill Country. So, hopefully very soon we'll be in that market too.
Right. And I know you used to be primarily, well, you were a general surgeon and
Mhm.
then critical care. And
Mhm.
now you're doing a whole different model. Can you tell everybody what your practice model is?
Yeah, for sure. So James Clinic was born out of COVID. As you've alluded to, I got fired during the middle of COVID, right at the beginning of the Delta wave, because two things, I wouldn't take the COVID shot, and that just became non-tenable. And also, they were removing treatments from the ICU. So I had to look people in the face and say, I'm intubating you and I'll do my very best, knowing I didn't have the very best available. So I just couldn't ethically do that. So James Clinic was born out of that. Now we are a concierge model. So the very best care that we get is having patients join our clinic. We follow up with them every month to make sure their health stays on track. We're staying consistent. That's really a lot of people can give a prescription, but having that consistent support is really essential. And then troubleshooting the plan, right? Sometimes something will work for a while and quit working, and we have to pivot and as things evolve. So the concierge model is really what we're focused on. We actually brought in a line of state-of-the-art testing as well. This mitochondrial therapy is so powerful that it's going to reverse illness. There's multiple studies where it's reversed dementia, it's helped stroke patients regain function, reversing fatty liver, reversing cirrhosis. So I brought in a whole line of testing that patients can do, functional testing. We can look at the blood vessels, we can look at the heart, we can look at the liver and know where we started and then have objective solutions for where we go with that.
That's wonderful. And do you do telemedicine? Can people from out of state consult with you?
We do a lot of telemedicine. We have patients all over the country. We recommend that they come to our office for that first initial visit, especially now that we have the functional testing. One of the things we have is really cool, and I definitely think it will help the vaccine injured, is the glycocheck. So one of the things that's been missing from the discussion is the glycocalyx. That's the lining of our arteries that look like little eyelashes or little seagrass. COVID actually mowed that down. So when you look at how that protects the inside lining of the arteries, without that, this is why people had heart attacks, strokes, blood clots. So we can actually measure that by putting a little microscopic camera under the tongue. We can get a health score of the mitochondria. It's very cool. You can look at your own capillaries and single red blood cells flowing through your capillaries. And we have a supplement called Revasca from the same company. We can actually rebuild that using a seaweed-based supplement. And, it helps regulate blood pressure and just repair basically circulation to all the organs of the body. So putting all of this together, I do think there's hope for people who are pretty injured.
That's very cool. Now, what's the name of that supplement again?
It's called Revasca,
Mm-hmm.
and the testing is called GlycoCheck. So coming up with the IMA, I believe we're going to have a webinar with the two professors that developed both the testing and the treatment and talk about this. They actually had these little cameras in the ICUs when COVID hit. They were studying it in critically ill patients. So they have exact timeline data of COVID patients and have stratified who didn't survive the ICU based on the health of their glycocalyx. So they have a lot of really good data that supports that.
Wow, that's very, very interesting. So tell everybody where to find you. Is it Dr. James Clinic or what's your website?
Yeah, jamesclinic.com. So jamesclinic.com. If you haven't been on it in a while, we've totally updated, rebuilt the website. So there's a ton of information there about what we do, how we do it. We're always hiring. So if you want to join our team, there's a careers page. See if it resonates with you. We want our people because we move at a very fast pace and it's not for everybody. But yeah, we're growing quickly. And again, a lot of information on there about what we do and how we do it.
Well, wonderful. This is promising. I don't know if you've been following, but we've been looking at filtration, and I know you were doing EBU. Are you still doing EBU?
We do, yeah.
Yeah, and this one though is in Japan. It has a special filter, and they're using stem cell growth factors. Tell us about your process with EBU.
Yeah, so EBU, it stands for extracorporeal blood oxygenation and ozonation. So basically, it looks a lot like dialysis, if anyone's familiar with that. So we put an IV in both arms. The blood pumps out through a small, slow pump. It's a little freaky to see your own blood outside your body at first, I will say that. But it goes through a dialysis filter. So it is not dialysis. This doesn't have a diacylate in it, but it's the actual filter. So we know that things get hung up in the filter. The blood is then exposed to oxygen, ozone. We run it through UV light and colored light. So we get the photodynamic therapy, and then it circulates back to the patient. And we run that circuit for about an hour. It treats about 2 to 3 liters of blood, or half of the blood. So you get 4 treatments in one. You get the filtration to pull out inflammatory cytokines. We think it pulls the spike protein, potentially biofilms, mycotoxins, cellular debris. Then we get the oxygen exposure. So we get those red blood cells to separate and pick up oxygen and carry that. There's ozone, which helps buffer the antioxidant system in the body. So it helps with that out of control inflammation, the reactive oxygen species. And then the light therapy stimulates the mitochondria, stimulates the immune system to take care of any latent infections and things. So it's a wonderful treatment. Truly, after I did that, it's the best I've felt in a really long time.
And what you do hyperbaric oxygen as well?
We do. We have the soft hyperbaric chambers. Patients really like that because they can sit up instead of laying in those tubes that you've seen. We use that specifically. I like it for patients with neurologic issues. Excuse me. I like it for patients who have specific wound issues as well. Um, there's so many different versions of like vaccine injury that it doesn't help all of them. So I've had patients with the cardiac issues who've done like 40 treatments and it didn't help. Well, we're not seeing that it would have. So we try to be really selective with that.
Yeah. And are you doing, the big push now is stem cells and peptides? Are you dabbling in that at all?
Yeah, we've always done PRP. So before we had the MitoRegen therapy, PRP was great for neuropathy, and it still is. It definitely helps those patients. I think there's a lot of people who had latent Lyme infections and dormant infections that once we had the immunosuppression from either COVID or the vaccine, these infections came to the surface. So for those patients who are kind of blown off and disregarded, we actually diagnose those. And then when we do PRP, it comes in and kind of resets the immune system in a way, so that your body's not looking at these infections just saying, oh, it's supposed to be here. It actually starts to fight those and do something and help with the inflammation. So PRP, we're definitely doing. We have some peptides that we've incorporated as well. And then we're building out an entire MitoRegen support process between infusions that includes, supplements that support our foundational supplement, CoQ10, red light therapy, just additional things we can do to help patients, progress out of where they seem to be stuck.
So is CoQ10 a big supplement for mitochondrial support?
It is. So if you look at the electron transport chain, I think of this as a series of water turbines, and we have to like push the electrons down the water turbines to kick out energy at the end. So there's 4 to 5 proteins in that water turbine, and CoQ10 helps push that forward at certain places. So definitely good for mitochondrial support. L-carnitine is another one that's good. And then working on detox. If you start your car in the garage, all that dirty air is going to be stuck in your garage. So we need to air that out. We need to make sure that the lymphatics are moving. So when the cell does rev up its energy, now we can exchange nutrients in, garbage out, and keep the whole system supported. So I think this is where so many things fall short. Is there just one, do this and you'll get better? No, you have to kind of do it all the way down the line so you have all the support. Once you fire up one mechanism, you've got to support that down the line.
So what do you recommend to patients in terms of detox, of getting the garbage out?
Yeah. Sleeping well, make sure to track your sleep. Make sure if you're not optimized, get rid of the blue light, get the red light. Our friend, Dr. Jack Cruz, has a lot on light and electromagnetic fields. So, when you wake up in the morning, get sunlight, put your feet in the grass, get your charges correct. Start with that. Drink plenty of water. Make sure your diet is as clean as possible as you can afford to do. Move your body throughout the day. Sweat, infrared sauna. Vibration plates are big. Rebounders, things like that. Get your body moving a little bit. And make sure you're having BMs every day, right? Literally getting all the stuff out is important. And there's so many people who are stagnant, and the more you're stagnant, the more you're stuck. So looking at it from that perspective.
Yeah, it is. When you really pin down how much you sit and lie during the day, it's pretty bad. You don't realize it until I went skiing last week, and I'm like, gosh, I'm never on my feet for 4 hours straight like this. Usually if I'm lucky, 20 minutes in the gym, and the rest of the day you're sitting basically. I don't think people realize that. And yeah, sleep is huge. So for people that struggle with sleep, what recommendations do you have?
Yeah, so one of the things I did a kind of a deep dive into is, again, the blue blocker glasses and settings on your phone and your devices if you're using those late at night to shut off that blue light. switching your LED lights back to incandescent bulbs. They have special night lights for your room that are red or amber light. So setting your environment, number one. A lot of people don't sleep well because their blood sugar crashes in the middle of the night. So we pick that up with continuous glucose monitors. So don't eat a heavy carb load before you go to bed, because patients don't always wake totally up, but it disrupts their deep sleep. I like trackers. I like to know what my sleep score is in the morning. So, if that's anything you're interested in. And then if we're just really not making progress, hormone optimization is great, especially for women, as they hit that point in life where menopause and hormones are causing a problem. And then there's a great sleep peptide, DSIP, that we've incorporated as well. Very good luck with that. We use a lot of melatonin in our practice as well. So kind of that, we just work everybody down, start at the basics and work our way up.
Well, let's talk about that peptide. I haven't heard of that. Is that an injection?
It is an injection. I believe it stands for delta sleep-inducing peptide. So what that does, again, just kind of helps set the mood, calm things down, get you into that delta wave so you can sleep. I do it as a short-term injection because usually if we can get the sleep cycle reset for people, they're good to go from there. So I think our vial is like 20 days, 40 days. So I have them do one round of it and then go off of it and see where they are. But we're definitely trying to pull them off of prescriptions. Patients who are drinking alcohol or on benzodiazepines, those are disrupting that restorative sleep. So we really want to get off of those. We have some neuro devices too that are really cool. We have something called the Brain Tap. It's a take on binaural beats. So it's actually a headset with an eye visor. And it's a guided meditation that basically helps patients get into the right brain waves to promote sleep. So there's a lot of things you can do that are non-prescription that actually may be much more impactful.
Yeah, I will say my big trick is I listen to a boring audiobook or I listen to a podcast and it distracts me, because you lay down and the first thing you do is start going over all the problems you have or things you need to do. It's like the first time you have a moment, right, to really contemplate. So my big trick is to listen to somebody else talking to get my mind off of my own issues. And I mean, that works 90% of the time. And I also think the hormones, the progesterone, if you are in menopause, that's huge. Do you do a lot of hormone replacement therapy?
We do. Yep. Again, there's two ways to look at it. There's these hormone replacement clinics where that's all they do. I feel like that's a part of what we do as an integrative clinic, right? We bring all of this in and sub-select. So, some of our patients don't want to do hormones. And so we have lots of different options for those patients, but it is a key of what we do and help patients when it's the right thing. So, yeah.
That sounds like a common sense approach, which we definitely need more of. Anything else that y'all are offering that we haven't talked about that might be interesting?
Yeah, the state-of-the-art testing, I'm just so excited about that because that paired with the mitochondrial regen, now patients, whether you're sick and trying to get better or you're good and you're trying to be a performance athlete, it's kind of the same hill. It's just where are you starting on it? We have the max VO2 testing, so you can run on the treadmill and get a lot of information about how effectively can your body start to make energy from oxygen and food and make that ATP. We can measure that. And then as we do these treatments like the Mito Support, the MitoRegen, getting your sleep, we can actually track your progress and give you objective data points. So not only do we have to help people, but we have to show them how we're helping them. And I love that. Yeah. It's fun.
Well, that's exciting. I'm going to come visit you and get the tune up.
Yeah, come on up.
Well, thanks so much, Molly. Great to see you again. And we'll have you back soon and get some updates.
Okay, sounds good. Thanks for having me.